Hello, my name is Camilo Ongarra and my presentation is about human neonatal rotavirus vaccine to target rotavirus from birth. Definition: rotavirus is a virus that causes gastroenteritis. Symptoms include severe diarrhea, vomiting, fever, and dehydration.
Which is the most common cause of diarrhea worldwide, particularly in young children, so children under the age of 1. And whilst rotavirus diarrhea caused by the bug isn't a major cause of death in the UK, it does cause a lot of children to be admitted to hospital with severe rotavirus infection. And these are children who are not able to particularly tolerate fluids at home and may need to come into hospital for blood tests, to have a drip put in, to have intravenous fluids. And so if we could reduce hospital admissions, which we expect to be reduced by around 70% with this vaccine, that would be a huge saving both for parents who have the burden of bringing their children to hospital and also reducing hospital stays within the NHS. Rotavirus is the most common cause of hospital admission due to diarrhea.
Application in medicine. A recent study implements a new strategy for administering the vaccine against rotavirus neonatal at birth in order to effectively attack early prevention against possible complications such as gastroenteritis caused by rotavirus placement and also address some of the barriers to the worldwide implementation of a vaccine against rotavirus.
Nearly every child in the world gets infected with rotavirus by age 3. The diarrhea it causes can result in severe dehydration and death. More than 85% of the deaths from this virus occur in Asian and African countries. As many as 2 million children are hospitalized each year because of rotavirus infections. The younger a child is, the more life-threatening the infection can be, which is why an oral vaccine is given to babies.
We gotta do rotavirus.
Okay. That's a little drink.
That's a little drink.
Babies normally get 2 or 3 doses starting when they're 2 months old. Several years ago, a rotavirus vaccine was taken off the market because it increased a baby's risk of developing a rare but potentially deadly intestinal blockage. Other vaccines have since taken its place, but a manufacturer's study of one of them, the Rotatech vaccine, suggested that it too might cause intestinal blockage after the first dose. Epidemiologist Irene Shui at the Harvard School of Public Health decided to investigate.
Because the rotavirus vaccine is given to almost every child in the United States, it's crucial to monitor the vaccine's safety.
Shui and other researchers examined the records of almost 800,000 babies who received this vaccine, including 300,000 first doses. They were looking for incidents of intussusception, the medical term for this kind of blockage.
We did not find an elevated risk of intussusception following any dose of the vaccine, and especially following the first dose.
Shui says even though the intestinal blockage is rare, it's important to continue to monitor these vaccines with additional studies like hers. And she notes that the World Health Organization recommends the vaccine be included in all infant immunization programs.
The benefits from rotavirus vaccine in terms of reducing the number of hospitalizations and deaths from rotavirus disease far outweigh the potential risk of intussusception that might exist.
Thank you, Angel. Aren't you doing great?
In the U.S., according to the Centers for Disease Control, the vaccines are up to 98% effective in preventing severe rotavirus disease in infants and young children. Carol Pearson, VOA News.
Issue applied in Ecuador. The two rotavirus vaccines are very safe and effective in preventing rotavirus disease. Many babies have received the vaccine safely.
A recent study found the rotavirus vaccine has reduced hospitalizations of children in the United States by more than 380,000 between 2008 and 2013. Rotavirus causes diarrhea in infants and young children, often leading to hospitalization. Dr. Eyal Hashem, who was a researcher at the Centers for Disease Control and Prevention during the study, said, "Our findings confirm the sustained impact and effectiveness of the rotavirus vaccine program. Increasing vaccine coverage likely resulted in the larger declines of rotavirus hospitalizations observed in the later years studied."
Pros and cons. Rotavirus can be very harmful. Diarrhea, vomiting, and fever can cause loss of body fluids. This leads to dehydration, which can be very dangerous, especially for babies and small children. Some children need to be given fluids intravenously with a needle in the vein in the hospital to replace lost fluids.
As parents, you're supposed to protect your kids and provide everything you can.
Our 2-year-old daughter had what we thought was just a run-of-the-mill stomach virus, and then she just became rapidly worse. Constant vomiting, constant diarrhea.
They were really having a hard time putting an IV in her, so they had to stick her over 10 times.
She was crying and there were no tears, because she was so dehydrated.
It was one of the toughest things I ever had to watch.
They came in and said that her rotavirus test had come back positive.
You need to get your child vaccinated against rotavirus because it is a serious cause of diarrhea, the one that's most likely to have your child end up hospitalized.
I'd called home to check on our youngest son who'd also been sick, and they transferred him by ambulance to the same children's hospital. And he stayed for 3 days and she stayed for 4 days.
Never crossed my mind that both my kids would be that sick at the same time.
My actions caused my kids to suffer.
Check with your provider to see if immunization is right for your family.
Conclusion. The best way to protect against rotavirus is to get the vaccine to prevent it. Doctors recommend that all children receive the vaccine.
From birth, young children are natural explorers. But as parents, there are some things we hope they never discover, such as the physical and emotional pain of a childhood disease like rotavirus. But what is rotavirus? Well, it's no one's best friend. It's a clever character, lingering on mucky hands and jumping effortlessly between children's bodies, as well as the toys they're playing with. As a new parent, you may be given. So how can our family be better protected? The most effective method, the earlier you take steps to protect your child, the better chance they have of avoiding a more severe attack, which, as we have seen, has to be good news for all the family. Talk to your doctor about protecting your child against rotavirus.